Hey viewers, this is Rizwan Syed with NRINews247.com. I have with us today Dr. Sudhakar, who is the president of AAPI. Dr. Sudhakar is going to have a conversation with us about AAPI and the role of AAPI in India and the United States, and about the vaccination for COVID-19. Welcome to this conversation, Dr. Sudhakar. It's a great pleasure to have you with us here today.
Thank you very much, Mr. Syed, having me today. Thank you, NRI247.com. And I'm sure I'm looking forward to interact with you next few minutes. Thank you.
So, Doctor, can we first begin our conversation with what is AAPI and the role of AAPI in India and the United States?
Thank you. It's a great question, Mr. Syed. AAPI, American Association of Physicians of Indian Origin, is the largest ethnic organization in the United States and second largest medical organization after AMA, American Medical Association. AAPI represents interest of more than 100,000 doctors in US, that including residents, medical students, and practicing physicians, academics, all kinds. AAPI established almost 40 years ago in state of Michigan, then it grows up to this level. It is a very vibrating organization, and AAPI does a lot of work in the United States and also in India. In the US, we do a lot of charity work. For example, during these holidays, AAPI delivered more than 3,000 blankets for the needy people through our chapters. AAPI has about 160 chapters. Chapter means each state of the United States has a chapter, okay? They're all linked to the AAPI. So about 30 chapters, they came forward and interacted with AAPI and distributed more than 3,000 blankets to the needy people for Christmas time. Okay. And we started recently the community outreach program through AAPI physicians. What they're doing, they're trying to educate the community various diseases. For example, last month is Lung Cancer Awareness Month, and AAPI did a webinar through the ZTV. I'm sure everybody knows what is GTV. And the VS almost more than 1 million people. And lung cancer awareness has been transmitted through the GTV to educate our Indian community. And this year, heart diseases, they see heart diseases, because heart disease is one of the dreadest problem in Indian subcontinent, particularly Indians, because risk is very high. And younger people die much younger than other Caucasians or Afro-Americans or Hispanics. So that has been viewed by the ZTV US last Sunday. And likewise, every month we're picking up a topic to educate our Indian subcontinent viewers through the ZTV. And not only that, and in India, AAPI has 17 charitable clinics in India, in different parts of the states in India. For example, Himachal Pradesh, Andhra Pradesh, Telangana, Gujarat, all over Bengal. These clinics see at least 1 million patients a year, which they see free. Okay, and we're very proud of that. And also, AAPI does a community purified water program. That means villages where they don't have water purification, they don't have good drinking water. AAPI will donate the well where the community villagers can go and drink the water so that they won't have any diseases. For this year, during my presidency, we are planning to do about 10 community purified water clinics plants in India, 5 in Uttar Pradesh, 5 in the state of Andhra Pradesh. So these are the vibrant things we do. And also, apart from that, the Prime Minister Modi has the vision of eradicating tuberculosis by 2024. AAPI playing a big role on that. Okay, we are working with a different part of the country with the TB team from the central government, and work with them and promote this TB eradication. And likewise, AAPI does a lot of community work, but we don't promote. I'm glad you asked me this question so that I can able to tell exactly what AAPI doing to your viewers. Thank you for the question again.
Yeah, this is great to know, Dr. Sudhakar. AAPI is doing a great job. Dr. Sudhakar, as president of AAPI, any specific project that is close to your heart and that you have already done in 2020, or you would like to do that in 2021?
Very good. Thanks for asking the question. I took the presidency in July of this year. Okay, that's where the change of gavel from previous president to me. And I promised our members I'm going to do few projects which I committed. Number one is the clinical observership program. I came to this country in 1987, okay, a long time ago. At that time, our physicians do not have much network, okay, because the organization was not very strong enough to networking with children who are just came from India to start in residencies in the United States. So what I did, I formed a program called Clinical Observership Program, where children come from India looking for residency in the United States. They need some experience, how to practice, how to talk to the patient. Language is a big barrier because a lot of Indians speak English the way the local Americans may not understand properly because of the accent, everything. So this 4 weeks, training, observing a local physician will definitely enhance their opportunity to get residency in the United States. So that program has been established and going. And because of COVID, we couldn't be able to do much because, restrictions and because of this disease problem, because we don't want a kid get infected with COVID because of this current situation. Okay. That has been done, is going on. And I think we have a very great committee. We're working on that to promote this clinical observership program, help our Indian kids get some experience before apply for residency. Number one. Number two, our organization, even though it is a number one ethnic organization, we don't have a strong medical journal. So I established the JAPI, Journal of American Association of Physicians Indian. This journal will be quarterly, will publish, and it's going to have great articles. It's a peer-reviewed journal for children can actually from Indian doctors in India can publish their articles, originals in this magazine. Okay, that's one thing. The third one is I'm offering free CME credits to our members as a membership benefit for a 24-hour CME. So one thing, great thing I'm planning to do, which already done, and every month we have 2 CMEs going on each month, so that our physicians can update a lot. During this pandemic, AAPI does several webinars, educate the doctors in India, United Kingdom, Australia, and Middle Eastern countries. So we really took a big, strong step because of worrisome, okay, because our doctors should know what's going on, what is the updates going on. So that big project we took over and we succeed, and we are still doing that to educate our physicians all over the world.
Yeah. Thank you, Doctor. This is great to know that AAPI is doing a great job for the Indian physicians or people from India who are traveling to the US to get them accustomed to the local methods of doing their practices. And definitely think AAPI has done a great job with the COVID pandemic too. So, Doctor, moving ahead with this conversation, what is this COVID vaccination all about? We would like to have your thoughts on this.
Sure. So actually, currently there are 190 vaccinations on trial in the entire world. Okay. And right now there are 2 vaccines has been approved. One is the Pfizer, one is Moderna, which has been given in this country, United States. Okay. Personally, I took Moderna last Wednesday, almost a week now. And some of my colleagues took Pfizer. Okay, which is the difference between Pfizer and Moderna. Moderna can be stored in regular refrigerator temperature. Okay, whereas the Pfizer has to be in a freezing temperature. Okay, the problem is storage is a big issue. Okay, and this vaccination has to take initial dose first, then after that 3 weeks for Pfizer and 4 weeks for Moderna. I think the booster dose. Okay, so the efficacy of the vaccine usually start kicking from day 7 to day 10. Okay, the vaccination effectively start kicking, okay, developing antibodies against the virus. Okay, my understanding, roughly about 50% of efficacy after first dose will help the patient who took the vaccination. But after the booster dose, it almost 95%. Okay, so the longevity of the vaccine effect this vaccine has been developed very fast track. Okay, we don't have much data how long it will long last. Okay, so based on the limited experience, okay, it will last for at least 6 months. Okay, maybe more than that, a year also. We don't know. Okay, but if you take the patient who got infected with the COVID-19, the natural antibodies can last from 6 to 8 months. That's what the recent publication. Okay, so obviously this vaccination can help you at least to hang around for 6 months to 1 year. Okay, and right now that is what we understand, but we don't know because we have to wait and see because the study was only for 1 year. Okay, so we'll wait and see the test antibodies, how long it lasts. Somebody took the vaccine, so that we'll have more studies has to come to understand more about the vaccination for years are coming. Yeah.
Doctor, we are now experiencing the second wave of COVID-19. Now, will this vaccination also protect people from the second wave?
100%. You should, because you're talking of the. So take right now we are in the United States. We are already having some second wave like California. Okay, and New York is much less though compared to California is bad. California is very bad. Okay. And India, well, luckily so far they're doing excellent, but they're expecting some kind of second wave in January. That's what I'm understanding from my colleagues. Okay, and if you take a vaccination, effect will be more than 6 months. Okay, so you should be able to protect the second wave. Yeah.
Is there any particular care that you need to take once you get vaccinated?
Not really. I took it last Wednesday. I did tell you, and my colleagues took it. Most of the time, we have a local reaction, the tenderness where the shot was given, vaccine was given. Some people may have some, like you see, when you have a flu, what do you get? You get some body aches, feverish feeling, some headache, myalgia. You may feel a little bit mild symptoms like that, but we have some reports that people can get panic. Okay, they get panic, and they get a little bit sweating. Some people got passed out, okay, after taking a shot, but they are recovered immediately, okay? They've been watched a little careful, they all recovered. For example, I had a video conversation. I noticed that, one nurse actually, she worked in critical care in one of the southern part of the country, and she does have a panic attacks naturally. She gets panic at least 3-4 times in a month, okay? And she took the vaccination, she's a nurse, and she passed out, okay? But she not lost any consciousness, but recovered pretty quick, okay? But these are the subtle incidents has been happened, but we don't have any major issues after taking the vaccination. So I think, so far is pretty good, the safety-wise, okay? And we cross our fingers and see, hopefully it will do better for our community.
Well, thank you so much, Dr. Sudhakar. And
I think they should take some drugs like paracetamol. India, you have paracetamol, something to help to prevent these body aches, certain things that will really take care of the problem. Yeah.
So I think with the vaccination, if you have some local problems and local symptoms, you have local drugs to take care of that. Else, the vaccine is absolutely safe and good for people to consume. So
absolutely.
Thank you, Dr. Sudhakar, for being with us and for having this wonderful conversation. We appreciate the kind of hard work which AAPI has put in, and all the Indian American doctors associated with AAPI have contributed their time and their efforts to get people out of this COVID situation. Thank you so much for being here with us.
Mr. I want to add one more thing, okay? During pandemic time, in the beginning of March, okay, we don't exactly how we help this community and the physicians. AAPI actually delivered and donated face masks and shields to the nursing homes and hospitals, okay, with free of cost, okay, because mask is a very big thing. You till today after vaccination, okay, you're talking of 5% of patients should still need not protected with the vaccination, okay. So I think we should still keep until you get the 100% perfect vaccination, we should put the mask, okay. We should follow the social distance, hand wash, okay. So we donated all the face masks to the hospitals and the community nursing homes, and also the Indian parents and stuck in the United States during the pandemic. AAPI took initiative and wrote the prescriptions, refill the prescription, because some people came with cancer problems, other came to check up and stayed with the children, and they did refill the medications, okay, pain medicine, or cancer medicine. AAPI took the initiation and refill those things for the parents and visitors stuck during the pandemic. Okay, we did a lot of work, but again, it is unfortunately this pandemic really hurt everybody, but AAPI did a lot of work for helping our community.
Well, that's really good to know, Doctor. And again, AAPI is one organization which has helped everyone in the United States for the COVID-19 situation. So we thank you again for being here with us and for sharing your thoughts about AAPI and about the COVID-19 vaccination. Thank you so much, Dr. Sudhakar.
Thank you, Mr. Sai. Thanks for having me, and thank you, NRI247.com. Thank you.